Go.
Hi, my name is Dr. Ujjwal Shake and I'm a physical therapist, and he's Mason Wallace. He's a student physical therapist, and today we're going to talk about different kind of exercises and the techniques that you can do if you have a hamstring strain or hamstring injuries. Mason, go ahead.
So I've included a link to this research article. It's a fantastic article for many reasons. One of them being that it's protocol based, and on top of that, the protocol is not based on time, like, oh, I'm 2 weeks out from my injury, I should start the next phase. There are 3 different phases that are criteria based, so you have to be able to achieve a certain amount of things before you can progress. So your rehabilitation may be a little bit longer than my rehabilitation, and also because hamstring strains come in different grades 1 through 3. Besides that, this article is really great because it shifts the focus away from what has been typical in hamstring recovery. Typically we've seen we want to try and isolate the hamstring, we want to try and stretch it, we want to try and strengthen it. That's all well and good, except that research has shown that those who have recurring hamstring injuries usually have deficits in their hips as well as their core stability. So we're going to talk about a few things that are in this article in the protocol. There are lots of things that are included within it. We're just going to touch on a couple of them. So first one is called the grapevine. This is something that you may not think involves the hamstring at all, but this is basically just a stepping pattern, and then you're going to increase the speed as you go along. So for example, this is a grapevine. You cross in front, you step, you cross behind, and you keep doing that pattern over and over again. And then you're going to go from side to side, increasing your speed. So eventually it becomes more like a jog, and then you can increase the speed as you get better. The second thing I want to show you is from the second phase, and that is the incorporation of some of the core movements that you can do in a bridge position. For example, I can come up into a side bridge, a body bridge. My body should be straight like an arrow, but this is where they include something different. I'm going to follow my hand all the way through and come back up. I'm going to watch my hand the whole way through like this. And that's the movement. So for that movement, you're really focusing on the external obliques. You want to make sure that you have a good, stable base, and you don't want your hips to dip while you're doing that movement. The next one is a bridge. This is unique in the fact that it's not your typical bridge. A typical bridge, you set your knees right outside your hips, you bring your core up as a bridge, and then this is the movement that they've included. It includes walking your heels out one by one and then bringing them back in. But the whole time, I'm focused on making sure that my pelvis doesn't move from side to side with each step. So this includes a lot of core activation. The next one is a single leg windmill. The single leg windmill, pretty straightforward. You make a T with your body. I'm going to use my right hand to come down and try and touch my left foot. So this involves a lot of balance, a lot of core, a lot of coordination. It's not the most advanced movement that you can think of, but it's very effective. So I'm bringing this down, coming back up. I do the same thing with the left hand, down to the right foot. Okay, all of these movements should be done pain-free. If you're going for repetition, you go for repetitions between 10 and 20. And if you're going to go for time, like on the grapevine that I showed you earlier, you can do that in 1-minute bouts 3 times. Once again, everything should be pain-free, and you should only go to the next phase if you've met all the requirements in this article.